I am Kim Yoon, Medical Director for Basic Clinic, and today we're filming in our Daly City office. We are a sleep center in that we see patients for their clinical problems. We also conduct sleep studies at night to evaluate what type of sleep problem they have at night. And a sleep lab is a place where plainly sleep studies being conducted. The range of sleep disorders can be from insomnia, sleepwalking, bedwetting for children, teeth grinding, to injurious behaviors. So it's not just sleepwalking, but people can reenact their dreams, causing injuries to themselves and other people. We can also look for concomitant problems in patients that have neurological diseases like Parkinson's, Alzheimer's, and of course sleep apnea. First, we have to admit that we are a country going with very little sleep. Basically, we give someone a merit badge if they can tolerate very little sleep, right? So it's a badge of honor. I had 3 hours sleep last night and look how well I'm doing. And so we have to change that attitude. And so one of the first things that we have to start raising awareness of is exactly what the textbook is trying to do, is that sleep is very important for our daily function. So the parents have to get involved along with the educators, looking for signs that these teenagers or students are not doing well. Did their grades all of a sudden drop and it's not due to substance abuse or something else? Are they having difficulty concentrating in school? Falling asleep in class would be a tip-off, you would think. Or at home, are they just not engaged and not motivated, and it's not from a mood disorder? So I think those are the conversations that need to be brought up. One of the major sleep disorders is actually sleep deprivation or restriction, in that we're not allowing ourselves sufficient amounts. Over the past 5 years, the number of hours that we spend sleeping has also decreased. So we really want to make a difference in our overall health. We should concentrate on the duration to lengthen that to adequate amounts, and also to the quality. To help us delineate the stages of sleep, we typically have electrodes on the head, on the scalp, to evaluate the depth of sleep. So the ones in the front would tell us better whether the individual being studied has light sleep or deep sleep. The ones in the back of the head can tell us better whether they're awake or asleep. And then we are very interested in rapid eye movement sleep. The eyes move both vertically and horizontally. And that's a stage of sleep where most people dream more vividly. And so to capture those eye movements, we have electrodes on the sides of the eyes to record them. And if we are interested in breathing disorders, typically we'll have some kind of sensor that look like oxygen prongs like people use in the hospital to check the pressure differences around the nose and the mouth. Now, as I mentioned, sometimes we look for teeth grinding, and so there are electrodes under the chin to look for any kind of movement. And those electrodes also help us tell whether someone wakes up, because when they wake up, those chin muscles also move. And then we have electrodes to record the heart rhythm, and a couple of bells to record what we call excursion, the movements of the chest and abdominal areas. And then finally, oxygen sensor on the finger, and then electrodes on the shins of the legs to look for any kind of twitchy movements, kicks or jerks during the night. For the cases that we worry about automatic behavior, like sleepwalking or injurious behavior that people have experienced, we usually add additional electrodes to look at the brainwave patterns in case it's a seizure. And we also use video recording. A lot of times when you're sleep deprived, very often they can look spacey. And so those individuals are really not what they seem. And talk to those individuals about getting enough sleep. You know, be an advocate. I think sleep is such a fascinating field because it affects each and every one of us.